We are Chris and Beth Bruno, and this is the Walking With podcast.
God called you to walk with people. He called us to help you.
Join us for a conversation at the intersection of theology, psychology, and ministry.
Each week, our goal is to replace a little bit of your overwhelm with more confidence in caring for the people you walk with.
Story matters and why we have to start there. Episode 1 was talking about our story framework. Episode 2, we were talking about why it starts with you as a ministry leader. And now in this last episode of this series, we want to talk about why it's so important in your role of walking with others, whether you call yourself a pastoral counselor or a discipler or a shepherd or whatever. Why is it so important as you walk alongside of others? So Chris, start us off with why this is relevant and what's something that you have seen in regards to this.
So last weekend, I and a colleague of mine went to do some wilderness first aid training. And this is a 2-day class that's put on to train people on how to be better equipped to help people with their physical problems out in the backcountry in the wilderness. Throughout the weekend, we ran some scenarios where we would get some training and then we would go and actually practice. And they actually used stage makeup and stuff like that to put blood and bruises on people. And we'd have to go out and figure out what was wrong with the person that we had come across on the trail, for example, and then move into some kind of treatment. One of the scenarios that they created was that a guy had gone, he was doing some trail maintenance, he climbed a tree to cut down a branch because it was impeding the trail. He fell out of the tree and sprained his ankle. And so the stage makeup was on his ankle like a bruise, and it was really kind of gross and cool at the same time. So I was one of the responders, right, to go out and try to figure out what was happening. So we come up across this guy on the trail. He's complaining about the pain in his ankle, and that it hurts and that we need to do something about that. And so the response first is to deal with that, but always keep in mind that there could be something deeper happening. There could be something more systemic to the person than is presenting as the injury. And through the process that we had been trained in to do some of this assessment of the patient, we came to find out through the questions that he had skipped breakfast this morning, that he also didn't have anything to drink, and that he was hypoglycemic. Right, this is all the scenario that they had set up for us and all that. And so the treatment of the ankle is important, but also the treatment of the hypoglycemia, because what happened when he climbed the tree was that he got swoony and dizzy and whatever, and that's why he fell out of the tree. Now, if we as first aid responders didn't deal with the hypoglycemia as well as the ankle, then we would have completely had other problems on our hands. It is the same thing in counseling. Okay, it is the same thing in counseling, that whatever seems to be the presenting issue, we need to deal with, but at the same time, it's usually not the deepest issue. It's usually symptomatic of a much deeper cancer, right? And what I find in pastoral counseling especially is that we spiritualize symptoms. We begin to look on the surface of what's happening, and if we can fix the symptom, then far too often it feels like we are fixing the problem, when in fact we're not. Usually what will happen is that if we address the symptom, it will pop up, something else will pop up in a different place. So we have to have our attention attuned to the deeper stories that could be at play and begin to parse those out with people and not just focus on the symptom.
I've heard this a lot lately with student ministry staff and some of the applicants these days who are fresh out of college, they're young, and they are facing things that we didn't 25 years ago, for sure. But one of the most common is unwanted sexual addictions, usually some sort of addiction to pornography. And that is one of those presenting problems. On the surface, it looks like an unholy addiction, right? Some sort of sexual brokenness, but there is often so much more beneath that, right?
Yeah, for sure.
Talk a little bit about what some of the more common approaches to dealing with those on the surface or, front and center issues are.
Yeah. Well, I like to think about it in two ways, and sorry to make it always go back to medical in this episode. For some reason, it's on my mind. Last week, a family member had to go to the hospital to get some stitches because she'd fallen and cut open her head. In the medical field, there's triage, where you come into the emergency room and you do what's absolutely necessary first. But from triage, if there's a deeper systemic thing, you go into the operating room, from the emergency room to the operating room. You do the deeper work there, and then you go into the recovery room, right? Mm-hmm. And so that's a framework that I like to think about with counseling. So if somebody is coming to you with, for example, the pornography or sexual addiction issue, right, there needs to be some triage. We need to find some ways to stop the bleeding, make sure the airway is open, and make sure the heart is beating right. Stop finding some barriers to access to pornography, finding some accountability of, I'm not going to be alone anymore, or I'm going to find a way to phone a friend when I'm tempted, those kinds of things, right? That's triage kind of situation. But limiting access is not healing the problem, right? We have to get into the deeper issue. It helps for now. We have to do that for now. But deeper underneath the addiction, for example, is our stories that are at play of being unwanted themselves, or being triangulated into a family situation that they didn't want to be in, being sexually abused as a child, having no sense of what masculinity, femininity is, and the world is more than happy to give us those kinds of answers, right? So there's always something deeper to the surface level issue. Mm-hmm. One of the big things, though, is that a lot of literature is out there with regard to pornography recovery that stays on that symptom level. It doesn't dive deeper into the stories that drive the symptoms. And there's even one out there right now that tells guys to put rubber bands around their wrists, and anytime they have a sexual thought or a temptation, they're supposed to snap the rubber band as like aversion therapy, he calls it. And so when I have a thought, snapping the band is going to make me now associate it with pain rather than pleasure, and so I'm going to stop doing it. Mm-hmm. And I think that is so surfacey, and absolutely not the way that Jesus engages people either. Mm-hmm. He's not concerned about our symptoms. He's concerned about the deeper issues, the deeper cancers that keep us in a disconnected state from him.
Mm-hmm. Often a lot of that falls into a category we would call sin management. In counseling, it's behavior modification. Right. It's just dealing with those symptoms and stopping there, and not getting at the broken roots that are going to constantly produce the growth if we're not getting down to the roots.
And the other thing that can happen too is the spiritualization of the problem, right? And so biblically, especially those in ministry, will go to spaces or places in the scriptures that talk about not lusting, not avoiding sexual immorality, those kinds of things, or even other things like anger or depression or anxiety. Do not be anxious, the Bible says. And so then we spiritualize the anxiety and completely miss the deeper story of what's going on there. Yes, Jesus doesn't want us to be anxious. Yes, he wants us to avoid sexual immorality, but we have to understand how we got to that place first if we're going to do anything really long-term healing for that.
Yeah. So somebody who is walking alongside of a college student or a parishioner, a congregant, or even a team member, a staff member that they are leading and supervising, and a confession happens, or a clearly they've been triggered, right? Like something has come up,
right? And
they're talking about it. What is the posture that leader ought to have with the person that they are caring for through a story lens?
Right. In Romans, Paul says that it is the kindness of God that leads us to repentance. It's not the correction of God. It's not the law of God. It is his kindness. And so I'm always going to harp on having a posture of kindness is going to be the most redemptive. It's not permissiveness. It's not, condoning the sin and saying it's okay, you'll be fine. Yeah, but it's a posture of kindness that the pastoral counselor, the minister has towards that person, that is not judgmental, that is not judging, right, towards them, the saying, you need to step away from XYZ. Like, we want to make sure that they are still honored as a person and recognize that, yes, there is something wrong that they're doing. There's something wrong or sinful or whatever, but to have a posture of kindness is going to establish the relationship with the person, which is what they actually need.
Mm-hmm.
Most addictions are attachment disorders. It's a disordered way of finding something to attach to.
Mm.
And so as a pastoral counselor, if you can offer them even in that one conversation or the many years that you're walking with that person, a different kind of attachment, you will actually be part of the healing process for that person. Isn't that amazing?
So we talked about attachment in the last episode. So go back to that one if you want to hear about the 4 different styles. That was really important and helpful. What are a couple of phrases, sentences even, that you can offer that would show that level of kindness that you're talking about?
That's a really good question. I always go back to kind of, it depends on the situation, and something along the lines of, I am not even really sure what to say right now, but I'm just really glad you told me. I'm just really glad you told me. Coming to me was one of the bravest things you could have done, and I want to honor your courage and desire to get out of the stuck place that you are and tell somebody about it. Well done. Well done.
Which that is probably the best response, because how many of us feel equipped to handle those big confessions or those big stories that get unfolded in front of us, and the fear that immediately comes when we're hearing something like that, especially for someone who feels like, I went to one class and I'm not equipped for all of this, right? So to just come at it humbly of, I don't really know what to say.
Yeah.
But encouraging and praising, like what you said, the courage. I love that response.
Internally, I would encourage the pastor or minister to not necessarily say this out loud, but internally to join Paul in 1 Timothy chapter 1, where he says, I am the chief among all sinners. That whatever has been just laid out on the table for me, right, that is a sin and that is wrong, and yet I know my own redemption and that Jesus has come significantly for me, and so of course he's going to offer that to this other person. And that's an internal posture rather than a statement that you would make, but it helps so much for you to not be disgusted, to not be overwhelmed, to not be confused or kind of freak out like, this is way above my pay grade, I don't know what to do with this. And just to still sit there with the person and be in that relationship rather than trying to eject out.
Right.
Right.
And you're talking about a sin confession.
Well, that's what you're saying, yeah.
Well, and not all major stories that are going to be presented are going to be connected to sin.
Right.
What's another example of a response a ministry leader could offer in kindness?
I don't know what to do to help you, but I am going to stay with you through this process and journey with you until the end.
What are you feeling right now?
Just that everybody wants someone to walk with them. And whether or not we know what to do, we can still stay with. And aloneness is one of the most terrible human experiences we could ever have. And even if you don't know what to do in a situation, to stay with the person. And that doesn't mean like physically with them, but emotionally with them and connect with them and make sure that they know that they have an ally who will walk with them through this, and we'll find ways to get help. We'll find ways to...
God called you to walk with this person, and he called us to help you do that.
Yeah.
And that's why we've called this podcast the Walking with Podcast, because that phrase is really important. And just as we wrap up this series on story and the importance of story, recognizing that you have one, recognizing that every individual that you are privileged to walk alongside of has one, to just see life through a storied lens is why we wanted to kick off this whole new podcast with that kind of a series and establish one of our core values in everything that we do. Chris, do you have any last thoughts?
I think, not to dive back into the topic after that wonderful conclusion, however, these places where there are sin confessions are most likely going to be the places where we ourselves are triggered as pastoral counselors, where someone says something about their struggle and it will bring to the surface your own, which is why back in the last episode we talked about it's so important to do your own work around these things first, simultaneously, at least at some point as you're walking with people.
Mm-hmm. Yes. Well, we want, again, to direct you to restorylabs.com, and there at the bottom of that homepage you'll see a microphone and a link to submit a question. We really want to be responsive to the questions that you have on the front lines of ministry. Our list of topics to cover have all come from pastors and ministry staff here locally or nationally that we're connected to, but we want to hear from you. So please submit a question if you have one. Download, particularly after today's episode, we have a free download called Mental Health Preparedness, 10 must-dos to prepare today for what might come tomorrow. I know I butchered that subtitle, but it's just a free download that I think will be really helpful in light of what we talked about today. And again, just if you want a visual of our story framework, go to restorylabs.com/episode 1 and download that for free as well. Thanks for joining us. We'll see you same time, same place next week.